Hi, my name is Mohammed Sarwar and welcome to our CWTC Get Connected community podcast to share experiences, promote services, networking and great opportunities available for residents of Oldham. As you know, community health is more than just healthcare. It's about the collective well-being of families, towns, boroughs and much more. It's the intersection of public health, individual choices, access to resources and the social structures that affect how we live and work. To help us understand better about this subject, we have invited to our CWTC studio Sophie Coggins and Marilyn Fisher from the Fitton Hill Bulldog Community Sports Club. Welcome both of you.
Thank you.
How are you?
Good. Yeah, we're good, thank you.
Yeah.
Are you feeling well?
Yes.
Good. Do you think winter is setting in?
Autumn's definitely with the rain.
Yeah.
Yeah.
Well, we've got to keep our spirits up, as they say.
Yeah, definitely.
Welcome to the studio. Can you tell me a bit about yourself, each of you? Sophie, maybe first. What do you do as a career, as education? What's your progression has been?
Sure, yeah. So my name's Sophie Coggins and I'm one of the co-directors of Move and Heal CIC,
Right.
which is a community interest company that's looking to provide free and affordable yoga sessions to the people of the borough of Oldham. My background is that I'm an occupational therapist and I worked for the NHS for about 10 years. And in that time, I became interested in yoga for my own mental health and well-being.
Brilliant.
From there, I started to recognise that I could use yoga as a therapeutic treatment for patients.
Yes.
Which is why I started Move and Heal CIC. I saw that there was an opportunity in our healthcare to provide support to people living with long-term health conditions through the tools of yoga.
Brilliant. And it's sometimes brilliant, isn't it, being an expert by experience and utilising that knowledge and skills that you've adopted to help others.
Absolutely, because one of the strongest skills that an occupational therapist has is the ability to make any practice individualised and person-centred.
Yeah.
So one of the issues with yoga is that people often say, well, I can't do yoga. I'm too, in their words, I'm too old. I have a health condition, which means I can't do it. I wouldn't be able to get on and off a mat. But the thing with yoga as a therapeutic tool is that every single body is a yoga body. Everybody can practice yoga, but you do need that appropriate guidance.
And I'm sure we will learn more about it. Marilyn, tell us about yourself.
I'm the treasurer and one of the trustees of Fitton Hill Bulldogs Community and Sports Club. We are a community centre now.
Yes.
We were primarily a rugby club, but we've now become a CIO charity.
Brilliant.
So we open to the community. So we have various groups going on, and Sophie runs yoga sessions from our community centre.
Excellent. And how long have you been going now?
The Bulldogs have been going quite a number of years, but the building that we have, it's taken 5 years to renovate.
Wow.
Because it was a burnt out shell when it was given to us.
Okay.
So
it must be looking good.
We've just opened in June, done enough to be able to open up for groups, and we also have a sports side as well, where we would be doing rugby and football.
I'd love to come and see your new place and have a cup of tea there.
Yes, absolutely. Yes.
Always.
Beautiful big kitchen where we can do meals as well. So.
Wonderful. As a trustee, somebody being on the management board, you must have seen and witnessed lots of challenges and issues over the years. What are these main challenges that you've witnessed?
For the Bulldogs, or we've had lots of challenges because from the beginning, when I first joined in 2021, like I say, it was a burnt out shell, so it was getting money from applying for donations, applying for grants and things like that. So it's been an uphill challenge for a long time.
So you have a good board, committed board.
We do, yes.
And would you say getting the grants were the main success for the centre?
Absolutely.
Yeah.
Absolutely. Without those grants, we just wouldn't have got where we are today.
Yeah. And you feel what you've achieved as a centre is going to help the needs of the area?
Oh, absolutely.
Yeah,
absolutely. The size of the building,
excellent.
Which means we've got a very large community, the main room. We've got a lovely big kitchen where we can do meals. We want to invite older people to come. So that's where we're feeding with Sophie's yoga, because she will invite for chair yoga, and then we can provide tea and cake or maybe...
Please do expand on the services that you're providing or you're going to provide.
We have a daycare centre that runs 3 days a week. They support adults with learning difficulties and autism. Okay. So they run Monday, Tuesday, Wednesday.
Timing?
It's 8:30 till 4.
Okay.
And then, so they have the centre those 3 days. And then Sophie has Thursday morning from 10 o'clock till 1:30. Okay. To do her sessions. And then we're free at the moment on a Thursday afternoon, so we're looking at the idea of inviting people to come along for coffee and cake or a chat.
Lovely.
And then that can then feed in with Sophie's. When she finishes yoga, they can sit and have tea and coffee, a chat, and maybe go on to do meals later on if we get enough people that want to do that sort of thing.
Excellent. Well, we're hoping to work with you. Yeah. And, as we find out what we can provide as well as a service, particularly around, supporting people on information and advice in terms of the crisis that we have with history, with housing, welfare benefits, your rent, debt. It's a
the centre's free on a Friday at the moment, so we're open to other groups that want to come along and use it.
Lovely. And as you can see, some of these services here, it's an example by visiting each other wherever you are, and then to lend ourselves to helping each other to have a bigger impact on the people who come through the door, really. Yeah. Brilliant. So what are you looking for in the future to develop as a centre?
We want to become a community centre. We want the community to have somewhere to go, because we lost the community centre 15, 20 years ago. Okay. And it was never replaced.
All right.
There is a small community centre, but it's not open up as what we would know as a community centre from years ago. Yeah. We want to be able to be there for the people of Fitton Hill. And because we do sports every Saturday and Sunday now, we've got football teams that play from there, and we're looking at ladies rugby setting up as well.
That's a great mix, isn't it? Yes, it's a whole family mix.
Yeah, absolutely. Very family orientated. And we've got 300 new homes being built in the area. Excellent. So that's 300 families coming in. Absolutely. So, we've got the facility there for provided to people.
Well, it's a whole regeneration of things, isn't it?
Yes,
to come.
Absolutely, yeah. We've got the sports field, so we've got a full-size rugby pitch, full-size football pitch, which we can do other sports on as well if we want to. Well,
it must feel great, as an individual to be able to contribute, particularly as a volunteer for the management, and to have such initiatives come into fruition, really.
Oh, it's just amazing when people saw it in the beginning, what it was like, a burnt out wreck. And
people give up, don't they?
They do, and people couldn't see my vision when I was showing them round. When it was black, it was burnt out. And I'm trying to say to them, this will be our hall, and we'll hold all sorts of things going on here.
You're a visionary.
Changing room. Oh yes, absolutely. And people were looking at me like I was mad. Yeah. But now it's come to fruition, and people are coming in who saw it in the beginning, and they're just amazed.
Areas need people like you. So well done. I'm sure we'll ask you some more questions after, or discussions, should I say. So where does the Move and Heal CIC come into the story with?
Yeah, so Move and Heal CIC was established in 2023, and essentially we are just looking to provide free and affordable yoga to people, but particularly accessible yoga. So a lot of the work that we've done in the community so far has been chair yoga, That typically tends to be people who are a little bit more elderly. So we ran some really successful sessions across Chadderton and Failsworth, and we received funding from the National Lottery Awards for All.
Excellent.
And those sessions have just gone down really well in our community. We've recently had a documentary be filmed.
Oh, wow.
And in that documentary, it really captures the impact that yoga has on people's lives, on their physical well-being, their mental health, but also the ability to bring together people as a community again, for people to feel connected to each other. So we were looking for funding from Sport England, but one of the stipulations was that we needed to do the sessions in a new space to attract new people into the accessible yoga sessions. So Nyan from Action Together kindly put us in touch with Marilyn. And obviously Marilyn has now this beautiful space where we can hold the now funded sessions by Sport England.
Well, Nyan, Action Together as a whole, the brilliant people. Very professional and get quality care, really. And so I would recommend people using Action Together as much as possible. So in terms of your mission as a director as well, how do you see your company move forward?
So our mission is definitely yoga for the many, not the few. And what this really means to myself, Julianne and Amy, who are my other co-directors, is we understand that people hear the word of yoga and they think that they can't do it for lots of different reasons, whether it be that in their words they feel that they're too old, or that they have health conditions that limit and restrict their physical movements, whether they see things on the television and it's kind of a Western approach to what people think yoga is, kind of contorting your body in strange shapes. People just hear the word yoga and then they're immediately put off.
Would I be right in saying yoga is a Asian practice, Indian practice? Would I be right in saying that?
Yeah, so yoga it's about 5,000 years old, and it comes from the people of the now drawn up northern India, Afghanistan and Pakistan. It does generally get given to India as a whole, but if we're going to be very specific and honour the roots of yoga, it's those three places that have been now drawn up.
Well, you see, I've just learned that today, because I would refer as India, maybe in Pakistani, so I feel a bit proud.
Yes.
So we'll work with you more.
Absolutely, yeah.
So if you can describe the yoga itself, you know, when you do the exercise, what does it entail?
Sure. So even that word there, yoga and exercise, yoga isn't necessarily a form of exercise. It's about an internal awareness.
Spiritual, much more spiritual.
So it can be a spiritual practice too. And that's something important to mention, is that people of different religious backgrounds think that they can't practice yoga because there's a misnomer that yoga is religious, and it's absolutely not. If you look at the timeline of religions, the people of Afghanistan, Pakistan and northern India wrote the ancient yoga texts before any religion was even created.
Right.
So yoga can be practiced by anyone of any faith background. And when we think about spirituality in yoga, we think... And
any age as well, you know. Or even physical ability.
Absolutely.
Sorry, carry on.
That's all right. So it's just to say that, people think that if they have a faith that they can't practice yoga. And that word of spirituality is also misunderstood. Right. Spirituality in yoga means connecting to that which is greater than you. Yes. So for some people, that might be a faith of a higher power or a religion. Yeah. But for other people, it might be something as simple as connecting to nature. I was just going to say, with this nature, with this God, somebody you love, it could be anybody that you feel connected. And also you connect with. Yeah. The connection to yourself. Yes. The connection from your own mind to your own body and your sense of who you are. Yes. So that's something that can be explored in yoga. And the other thing that you mentioned there is age, and that's right. We at Fitton Hill Bulldogs Community Centre now run 3 different types of yoga classes for this reason. We have a mat practice for people who can get on and off a mat physically. We have a pregnancy yoga practice for people in their 2nd and 3rd trimesters. Very good. And then we have a chair practice for people who can sit in a chair unsupported. that's what makes yoga accessible, is the different types that you can be guided through.
Brilliant. So much you can do through yoga, can't you?
Absolutely,
yeah, I'm coming and taking part in the next one. I got my whole team in
Everybody
coming
is
up
welcome.
to you. Brilliant. The funding that you mentioned from the lottery, and then you got some money from Sport England as well. Tell us about it.
Yeah, sure. So there are lots of pots available for people who are running a charity or a CIC. A community interest company is basically set up for the community. So all of the money that we receive as funding goes into the sessions of yoga to provide free sessions. So these sessions that we're running at the Bulldogs are absolutely free. Somebody came last week and at the end said, "So how much do I owe you?" And I was like, "Nothing, it's free." And we'll be running from July this year, 2024, to July 2025. That's something that we're really passionate about at Move and Heal, because a typical yoga class costs between £8-15 for pregnancy yoga. And as you've just mentioned, we are living in a cost of living crisis. We have had austerity for a long time, and many people are in working poverty. They're working, but they don't have the money to spend on their health activities. So that's why we wanted to provide these free yoga sessions for a year. For everybody's welcome to come to the sessions.
Brilliant. And the cost of living crisis that we do, which is part of the council's workshop that we've learned, and we deliver that now. And it's amazing, people do not know how what benefits are available out there, or where to connect, etc. So a combination of these things will help. Marilyn, do you want to add anything that will help the organisation?
It's just to make people aware, because it's taken 5 years to build this. And even some people in Fitton Hill don't even know that we're there and we're up and running. So it's just getting the awareness out there to people, and the groups that we provide that can help the whole community.
Well, this is the whole point why we do our podcast, which is also supported by the Reaching Communities and Greg's funding as well. Is to support organisations like yourselves, absolutely free, so they can get the message out. So we will do the marketing on our platforms, as well as you having the link, and you can tell the world about it. Get more people through the door.
Lovely.
And some more sponsors as well to help your organisation.
Any sponsors help?
No money, no show.
Exactly.
You can have the commitment as far as you can, but you got to pay the bills.
And we need some heating.
Absolutely, we do.
Oh, right, okay.
Heating, because it's an ex-NHS building, which is a porter cabin building.
Okay.
So it's not brick built.
Okay.
So obviously the insulation isn't as good as a brick built building. So they were stripped back to the bare bones. So we've got no heating in there at the moment. We've got some plug-in radiators, but they're not very. It's a really big room. To heat.
Well, listen, you businessmen out there, it's something that we need before the winter sets in. Please help the centre and get some heating in. Anything else, Sophie, you would like to add?
This particular question, or in general?
In general.
In general, what I think I'd like to mention is the benefits of yoga, because people just don't seem to understand how yoga can have a drastic impact on their long-term health.
Sure.
So most people that you speak to and I speak to are living with a long-term health condition, and the appropriate treatments are available on the NHS. But what people don't realise is that they can also manage the symptoms of their health conditions by a daily practice of yoga.
Themselves,
Exactly. A conservative approach, we would call it, an active approach to them managing these symptoms. And yoga has now been scientifically proven to support people with certain symptoms. These can include high blood pressure or blood pressure issues. In our cardiovascular system, the way that our heart beats and connects into our other systems, we have something called a baroreceptor. The baroreceptors is the body's ability to regulate your blood pressure. So clinically, what they've found when they've done research using people and then doing yoga with them is that it influences the baroreceptors' ability to regulate their blood pressure.
Okay.
So I've had people that I've worked with that can have a very unstable blood pressure, and then it can shoot up dangerously high. And perhaps in the past, they definitely would have needed to have called an ambulance and gone to A&E and presented, and the staff at A&E would have supported them, as the NHS does. It's amazing. But through teaching this particular person that I'm thinking of simple breathing exercises, that person is now able to feel the symptoms of their blood pressure go up, do some breathing exercises, and then find the stability of their blood pressure. And in that lady's case, she then didn't need to go to A&E.
Brilliant.
So this is a simple example.
So you're saving the cost for the NHS.
Absolutely, but also it's that emotional distress, isn't it?
Yes.
Of needing to go. So both, yeah.
And relax. How to relax, really.
Yeah, definitely. It's relaxation's one thing, but also being responsive rather than reactive to symptoms that you can experience in your life. Another one that I've often seen is chronic and persistent pain. So lots of people in our country and across the world are living with chronic and persistent pain. And as an occupational therapist, that's the area that I specialised in chronic pain. And again, yoga has been shown, has been found, so this is in the research, but also in my professional experience, to support people living with that long-term health condition. Because chronic and persistent pain affects lots of different areas of your life. It's a very debilitating condition where people sometimes don't feel like they can get out of bed. Maybe they can't hang out with their friends and family. So what yoga does is it looks at all the different aspects of your life and asks, are you drinking enough water?
Yes.
What type of food are you eating? How are you managing emotional stresses? How are you moving your body?
It's looking at the daily plan, isn't it, really? Weekly plan, so forth. How you manage yourself.
So looking at lifestyle changes, how are you sleeping, and also the physical movements that maybe somebody can simply just do either one in bed, sat on the edge of the bed, in their chair, or whilst the kettle's boiling. There's
so much that can be achieved through the yoga sessions that you're providing, and I'm sure there's a lot more that we will learn from. Sophie, thank you so much, and Marilyn, thank you so much for coming. And what do you think of our facilities?
I love it.
From the studio.
Okay, and hopefully we'll be able to get some more service users and funding through this great podcast. Thank you so much for listening, and hopefully you will be able to visit the Fit and Health Centre, as well as provide some financial support as well. Thank you. God bless.